Welcome back to Concepts Part 2. We're going to move on and talk about neuroplasticity right now. This is a very emerging field in science, and it provides a lot of hope in all kinds of fields of wellness, health, healthcare providers, because originally it was thought that the brain so much couldn't change. The patterns, the way that we moved, the way that we thought, if there was injury to the brain, it was that philosophy of you can't teach an old dog new tricks type of thinking. So, for example, someone with a stroke and an injury to an area of the brain, and they thought, like, for example, they couldn't use their left arm, or their speech was affected, something like that. That was how they had to live for the rest of their lives, for example. Or like a traumatic brain injury or a concussion, that's how the person had to live. And we now know that the brain can heal, grow, and change. So someone with a stroke, or someone with a brain injury, or someone that's just trying to learn new patterns of moving and thinking and accessing their brain in a new way, this brain to body connection, we have endless possibilities, because in neuroplasticity, the definition just means that change is possible in the nervous system. So remember, we talked about the central nervous system being the brain and the spinal cord. So we now know that change is possible there. So for example, I had a patient with a spinal cord injury, and she was told that she'd never be able to walk again. And she is of more the rare end, but there is possibility, and she was determined to say, F you to the doctors, I will walk again. And she essentially did prove them and changed her original diagnosis of the spinal cord injury from, there's ASIA scores, from one ASIA score to another, and she literally walked into my office. Now, she has things to improve upon still, and some cognitive things going on. However, it just shows that she had a very severe injury to her spinal cord, and at one point, like in the 1980s, the doctors would have said, shoot, that's it. This is the end, the extent of the healing capability of your spinal cord. But we now know that in some cases this is not true. And the other component that came to this was her belief. It was rock solid that she was going to walk again. Nothing was going to stop her from walking again, and she's walking again. So change is possible.
That's great. I see that more and more these days in what yoga therapists have to do, more than just knowing specifics about how the body moves, how we tie in respiration, and all of the tangible, you could say physical and neurokinetic aspects of therapy and wellness into an individual's protocol, but there's actually a huge psychological factor, and anybody that's studied pain in depth, as Allison has, will always tell you that there's an immense psychological and emotional aspect to when somebody's dealing with pain, when somebody's dealing with trauma. And what you will actually see is the longer that somebody's had pain, and the more that they might have had other specialists, you could even say program them into a belief of, well, this is just what you have, and this is just kind of like the deck of cards that you're dealt with for the rest of your life, the more it starts to kill their hope. And so what we do much of the time as yoga therapists, we're not just applying therapy to somebody's body, we're applying therapy to somebody's mind, a huge part of which is their hope, their sense of hope about what's possible, their sense of hope about, is change even possible? So there's a lot of good work to be done there, and the more of these good results that we see in studies from science about the fact that we actually can grow new neurons, which is not the old way of thinking in neuroscience, and how neuroplasticity is such a big determinant of somebody's wellness and health, the more hope we can instill into people.
So now we'll go over some common questions of these concepts of the first part. Often we're asked, well, if we can create new patterns, there is neuroplasticity. How does this happen? How do we create these new patterns? As therapists, it's first learning what functional movement looks like ideally. We all have our own functional ways of moving in our body, dependent, for example, like how long our bones are in relation to our torso, or what type of muscle fibers maybe we're dominant in. There's certain things in our physiology, that our deck of cards that we're born with, that we have to work with. So functionally, how does our body move best? And as a practitioner, it's really helpful to begin to realize what is ideal movement in someone versus the non-ideal movement. And that's where movement screens and watching your students move in classes become very helpful. So then when you notice someone in your office or on the mat, and they might not be moving in the most ideal way for them, right? For another person it might work well, but for them it's not, and you know that because they have pain, maybe they mentioned to you. Or you might notice they're putting themselves at risk for injury by just excessive wear and tear on a joint. Then it's taking a step back, and for example, let's take chaturanga, or another question we're asked is, what's an example of a dysfunctional movement pattern? So we can take, the common slump asana position that most of us are in this, a lot of people are in this desk position all the time with short and tight pecs, the head is forward, some areas of the neck are weak, that sort of thing. So then when they go to lift their arm overhead, it's very limited. So they could be stuck in this type of pattern. Or they have very tight muscles through like lats and subscapularis, for example. So then when they go to raise their shoulder because of tightness, they can really only go here, but they really need to get something out of the closet. So instead they overextend their spine. So two different movement patterns that could be dysfunctional, leading to shoulder pain, for example. So how do you change these patterns, right? First, you have to work with the areas of resistance. So in this position, opening up the pecs, strengthening certain areas of the neck, creating awareness on just how they're sitting every day. So working with what's in their control, strengthening and lengthening, and then fine-tuning and creating a balance. And then taking that awareness into different movements of how they move in life. So you have to break it down and then rebuild it back up. Want to expand upon that?
No, I think you nailed it very well.
Okay. All right. So another question we're asked is, are there patterns that cannot be retrained? In my brain, no. I think if you can take something far enough back, and take someone to the bare bones, then anything can really be retrained within the limitations of their body. But the capacity for the mind to handle change, I think sometimes we think too small in that capacity.
The good thing to consider there is that we're giving certain cards, we're dealt certain cards in life, obviously, that we can't change. I can't make myself shorter or taller, give myself, a different eye color or skin tone. The most malleable thing about human beings' embodiment is their brain. It's their behavior, it's their thoughts, and this is, again, the purview of yoga therapy. It's not necessarily can we change your body, it's can we change how your brain and your mind interacts with your physical existence. So if anything is changeable in the human body, it is our thinking and our behavior.
So another question we're asked is, are there limitations to this change, especially in regards to spinal cord or brain injury? And that answer sometimes is yes, especially if you're working with a neuroanatomist or a neurophysiologist who really specializes in the brain and the spinal cord, because they'll be most up to date. But for example, let's take the extreme. If a spinal cord is severed, right now there's no way to rejoin the spinal cord and get that level of movement and function below the level of injury. So if there is a complete if the spinal cord is completely severed, then that's kind of final. There is a limitation. Or if there's certain area of the brain that is deprived of oxygen and nutrients for too long, a certain amount of time, yes, there's limitations there, that part of the brain may be physically dead, or can lead to death, right? And there you have a finality, there is a limitation. So, but again, those are more of the extremes. In these areas of gray, of brain injury, concussion, spinal cord injury, there is a lot of room of growth, but there are some limitations.